Hi everyone, this is a little bit different to how we normally do it, but given that a lot weren't able to log on yesterday for the second session of the Inside programme, I'm just recording this so that anybody who would like to know a little bit more can still come away with the information. So I hope it's helpful. So the second session is looking at addiction and mental health. So I suppose these are two topics that are often intertwined and kind of enmeshed with each other. And the co-occurrence of a mental illness with substance use is kind of the norm rather than the exception, that it happens more so than not. That if somebody is using substances, it can impact on their mental health, and if somebody has a mental illness, then substance use can be used as a way of coping or managing that. So we'll discuss that, I suppose, over the next little while. So during the session, we'll look at what is a drug, effects of drugs on the central nervous system. We'll have a little chat about the brain chemistry, dual diagnosis. So dual diagnosis means that there are two things happening at the one time, and this being mental illness and substance use. What can you do as a family member when this happens? There's a short video on checking in with somebody, and then we will end on supports and resources that might be helpful going forward. So firstly, I suppose it's looking at what is a drug. Now, last week in session 1, Understanding Addiction, we had a discussion about drugs, and the topic of antihistamines came up, and that is something that can be abused. But there are lots of prescription and over-the-counter drugs that can be abused. For example, Nurofen Plus, antihistamines as mentioned last week. There are a number of depressant drugs that can be addictive. There are many pain treatments, for example, morphine, Lyrica, Nurofen Plus, because the Nurofen Plus has codeine. Same with the Solpadol, that's got codeine, and that's the addictive element to it. But yeah, the codeines, your OxyContin, oxycodone, they're just to name a few. But I suppose it's just important that you're aware, that everybody's aware, that if you're prescribed one of these drugs, that your GP or your pharmacist will let you know that these drugs can become addictive, or you can get addicted to them. So if you find that, say, the recommended dose is 3 per day, and you find that you or your loved one is taking more than that, or feeling the need to take more than that, then that might be a red flag that you need to speak to your GP or your pharmacist about. It might be that you need an increase in your pain medication, but it also might indicate that there might be dependency starting there. So I suppose looking at what else are drugs, one of the pictures there looks at prescription medications. The other there is alcohol, coffee. So again, the caffeine element. Caffeine is a stimulant. So I suppose people might feel a little bit more alert after taking it, but it can increase our heart rate, our blood pressure, our breathing rate slightly. And caffeine as well can also be in a lot of fizzy drinks or mineral drinks, along with sugar. So sugar is another thing that while it's legal, it can impact how we feel. So any substance that affects how the brain and the body works and changes how we think, feel, and behave would be classified as a drug. So there are lots of things that can fall under that category. Effects of drugs on the central nervous system. So we touched on this as well last week, looking at depressant drugs. So under the class of depressant drugs would fall alcohol, cannabis, opioids. So they would be your OxyContin, your oxycodone, your morphine, heroin, codeine. So those types of medications. And the last one there being benzodiazepine. So they'd be your Valium and your Xanax, those types of drugs. The middle column there is looking at stimulant drugs. So they would act in a different way. While depressant drugs slow down heart rate, breathing rate, your level of consciousness, stimulants would increase our consciousness, make us a little bit more alert, increase our blood pressure, our heart rate, our breathing. And examples of these can include caffeine, nicotine, ecstasy, methamphetamines, so like your crystal meth. Ecstasy, sorry, I just saw is also listed there. I thought I left it out. The third one there is hallucinogenics. They would include LSD, magic mushrooms, ketamine, and cannabis. So cannabis falls under both. It can be a depressant, but then in high quantities it can be a hallucinogenic. So a hallucinogenic drug is anything that distorts reality. So a person might feel, hear, or see things that aren't really there. So they might have hallucinations, audible hallucinations or visual hallucinations, or they might become paranoid, that they are hearing or sensing things from, say, the radio or from the TV, for example. This slide just helps explain a little bit about what's happening in our brains when we take substances. So there are three main neurotransmitters that are impacted by drug use, and I suppose looking at these might help explain the difficulty sometimes in stopping the use of substances. So the first one there is norepinephrine. So this is a stress response chemical, and it gets us ready for fight or flight. It mobilizes the body for action and it increases blood pressure. Dopamine is our pleasure and reward neurotransmitter. So as it states there, dopamine is a reward chemical within our brains. It mediates motivation and desire, and it's highly addictive. So I suppose when we experience feelings of pleasure and reward, we're more inclined to do or repeat that action again. If we're low in dopamine, it might come across that we're low in motivation, low in, I suppose, what would have given us pleasure in the past might not give us pleasure anymore if our dopamine levels are low. And the last one there that we're going to look at is serotonin. So that's our happy hormone, the love chemical. Brings that sense and feelings of well-being and happiness. And serotonin is responsible for regulating mood, appetite, and sleep. So these three neurotransmitters can have big impacts on how we feel and think and behave. So often where there is substance use, it releases lots of these hormones from the stores in our brain, or not hormones, these neurotransmitters from the stores in our brain. And what can happen is that we can have these immense feelings of feeling happy and content, feeling pleasure and reward, and feeling like you've got this surge of energy down to the norepinephrine. So what happens then with prolonged drug use is that our natural stores of these within the brain become really low or become depleted. So we find it really difficult then to feel pleasure and reward, or to feel happy, or to feel like we've got energy. Because the substances that we've taken have lowered the natural levels that we have in our brain. Our brains make these neurotransmitters and would have a certain number in their store. Drugs are taken, there's a rush of these neurotransmitters around our brain, we feel immense, and then over time these stores become depleted or really low. So it might come across that somebody is unmotivated, that they lack desire to do anything, that they might crave things that make them feel happy. I suppose it's difficult to kind of put into words, but I've heard of and worked along with people in treatment who would say, that it takes quite a while for those neurotransmitters to be replaced. That in early treatment, you know, it can be really difficult to stay motivated because you might feel really crap within yourself. Low in energy, low in motivation. And I suppose the one thing that can help with that is continued drug use. And again, that adds to the addictive nature of substances. You know, if I'm feeling really crap and unmotivated and low in energy and I don't feel happy, I know that taking that substance will make me feel happy and motivated and full of energy. So again, I suppose it's just to give an understanding of what's going on a basic level within our brains. What helps, I suppose, replenish those stores of those neurotransmitters is rest, good diet, time. You know, those early days of treatment can be really difficult because those neurotransmitter stores are really low. So allowing time, good nutrition, rest, exercise can really help to rebuild those natural stores so that people do feel happiness, they do feel well within themselves, they do feel motivated to keep going. The next thing we're just going to look at is polysubstance use. So that's using more than one substance at one time. So for example, somebody might be drinking alcohol and smoking cannabis, or drinking alcohol and taking cocaine. So two substances or more at the one time. So polysubstance use might occur if somebody wants to increase or enhance the effects of the primary drug. So for example, it might be taking a sedative tablet with alcohol, which I'm not in any way promoting because it can increase our risk of overdose. But if somebody is having trouble sleeping and they take a sleeping tablet and then decide to drink on top of it because that makes them a bit more drowsy, that might be an incidence where somebody would use more than one substance at the one time. Or another reason that people might take more than one substance at one time is to reduce negative effects. So if somebody has been on a binge of cocaine for 2 or 3 days, they might feel really alert but also really exhausted and they can't kind of come down from that alertness. They might smoke cannabis to help them to come down from that, to help the come down go a bit more smoothly. They might kind of try and balance that stimulant use with a depressant to try and smooth out that come down. So that's mentioned there in the second one, to relieve come down or withdrawal. If somebody is starting to withdraw from a substance, they might take another substance to try and take the edge off. But there are great harms where there is polysubstance use. So combining stimulants, for example, so if somebody is to take cocaine and ecstasy, it can lead to serotonin syndrome, so depletion of serotonin being our happy hormone. Ecstasy in particular targets the release of serotonin. It can be sometimes called the love drug. You have this immense feeling of well-being and love for yourself and everybody around you, is how it can be described. So again, going back, you've got this big surge of release of serotonin within the brain that can lead to depletion of it. So someone is left then with serotonin syndrome. Another thing can be heart problems, anxiety, panic attacks, and psychosis. Again, because stimulants speed up our heart rate can increase our blood pressure, and our breathing rate can lead to anxiety and panic attacks and psychosis in cases. Combining stimulants and depressants, for example, cocaine and cannabis, this could lead to heart problems, overdose, as one drug can mask the effects of the other. An example of this might be that somebody has taken cocaine and they might have smoked cannabis as well, or they might have taken a depressant drug as well, and because they're not feeling the full effects of the cannabis, they might take more of that to try and get that high that they're seeking. So the high of the cannabis might be masked by a depressant drug. And psychosis as well can be another risk where stimulants are combined. The third thing there, as I mentioned earlier, is combining depressants, which can be really dangerous because there is an increased risk of overdose. An example of that is alcohol and benzodiazepines. So, for example, if somebody takes a Valium alongside alcohol, both drugs work to slow down our heart, slow down our breathing rate, slow down our blood pressure. But if a person takes a large quantity of those, it can slow everything down to the point that our hearts just stop. So there is an increased risk of overdose there too. Apologies, this slide won't go any further for me. 1 second. So when we're delivering the Insight program, we allow a little bit of discussion around this point about what sort of behaviours might result from these brain changes that we've just discussed. And again, going back to our iceberg, kind of what can we see on the surface? So what we might see is our family members having mood swings or loss of interest in activities. It might not be in activities, it might be loss of interest in the relationships that they're in, or the relationships that they have with their children or their partner. Or, they used to be really into football and now they just couldn't be bothered going. Or social isolation, withdrawing. And I suppose what's going on underneath that iceberg to cause those impacts. The second thing to have a think about are what are the impacts of these behaviours on the person taking substances, but also on you as family members. Drug use and mental health. So I suppose at the start I mentioned that these two topics are often intertwined, and it's really difficult to kind of separate one from the other, or separate a mental illness from substance use if they're both happening at the same time for a person. And examples of these can be anxiety, depression, ongoing paranoia, psychosis, difficulties in separating drug effects, and withdrawal from mental health symptoms. So if a person is feeling anxious and they're taking stimulants, the effects of a stimulant can be like symptoms of anxiety. Or if somebody is withdrawing from stimulant drug use, they might have symptoms of depression. Often when people are withdrawing from substances, they might feel unwell, they might feel like their heart is racing, they might have symptoms of anxiety, where they might be curious about, am I going to have a panic attack, or is this down to withdrawing from a substance? So it can be difficult to tease out what exactly is going on for that person. A person might be feeling paranoid, and is that paranoia down to an underlying mental health illness, or is it down to increased drug use? Have they been smoking too much cannabis lately? And is that what's causing the psychosis? Or is someone smoking cannabis to help limit the impact of a mental illness? They might be hearing voices, and is smoking weed helping to numb those voices out a little bit, or to drown them out a bit? Has smoking cannabis been an effective way of trying to cope and manage with what's going on? So it can be a really difficult thing to try and figure out kind of what is the cause of this. Is it drug use, or is it a mental illness that's the cause? So I've got a little video here. Hopefully it'll work. If it doesn't, I'll send a link out to everybody. So looking at dual diagnosis. So the relationship between substance use and mental health is complex and can mean additional difficulties for both the person and their families. Dual diagnosis is very common. The most common mental health disorders for people who use alcohol and drugs in a harmful way are mood disorders, anxiety disorders, and personality disorders. These issues can be worsened when there are external factors going on, like we had ongoing COVID-19 breakouts, that were impacting on people's mental health and how people were coping with them. So the important thing to remember is that dual diagnosis is more the norm than the exception. And this can be down to a number of reasons. There could be ongoing trauma or childhood trauma or previous trauma of some kind. Alcohol and drug use can exacerbate the symptoms of that trauma. Substances can be used as a coping tool. This happened and I found that smoking cigarettes really helped me to cope and manage that. So it's looking at, I suppose, the role that the substance plays in that person's life. Is it a coping tool for something that is underlying? Is there anxiety there and they drink alcohol as a way of trying to manage that anxiety? So just to be curious about that. I'm just going to see if this will, it's not going to play. I will send a link to everybody for that video. So when we're doing the group normally, we would allow time for discussion on looking at the effects of this on your mental health. What are the impacts on your health, on your relationships, on your finances, on your job or your education? Are you finding that you need to take time off work sometimes just to take time for yourself? Because when you are home or when you do have time to yourself, you're consumed with what that person is doing. Is it impacting on your finances? Have you had to lend them money or give them money or take out a loan? Have you withdrawn from family members and from friends and from social networks? Is it impacting on your sleep, on your eating habits, on your mental health? Do you find that you sometimes get anxious? Or do you get depressed about the situation? So it's just having a think about the impacts, yes, that it's having on the person taking the substance, but for you as a family member. So what can we as family members do? One thing to keep in mind is not to assume that the person knows nothing about their own mental health. They may be aware that they're irritable, and they might know that it's down to the drug use, but they might not either. So I suppose not to assume that the person knows nothing about their own mental health. Avoid blaming language. And a useful tip in avoiding blaming language can be starting a sentence with I rather than you. If we start with blaming language, it often shuts down communication and the person that we're speaking with gets defensive. Having realistic expectations. Offer consistent emotional support and understanding. Treat the person with respect and dignity. Encourage them to talk to you or a professional. Ask if they would like more information and get help and support for yourself. This is another video that I would play at the end of this session as well, but I will send you the link so you can watch it in your own time. Apologies, I can't get it to work while I'm recording. And just to finish with some key messages, that the impacts of drugs can vary from person to person. A person's drug use can affect their mental health and vice versa. And that chicken or egg scenario, we often don't know, which came first. Is it a substance that's causing a mental illness, or is it mental illness that's leading to substance use? The longer a person is abstinent, the more improvement you will see in the thinking and emotional parts of their brain. Again, because time is allowing for that natural store of those neurotransmitters, the norepinephrine, the dopamine and the serotonin, to be replenished. And I think letting people know that who are in recovery is really important, so that they know this isn't going to last forever. I will begin to feel normal. I just need to give it a bit more time. Try to understand the drug use from the person's point of view. And this is a really important one, to be curious about what is it about this drug that makes it so great for them. Some people might say, you know, I just don't feel like I can socialize without having a drink or without taking something. You know, I feel more relaxed and more chatty around people. That can indicate to us that maybe it is social anxiety that they might have. That drinking alcohol or taking a substance helps to relieve some of that anxiety for them. And it might help us or them to come up with strategies. Okay, well, look, instead of drinking or instead of taking this, maybe I could use a little bit of mindfulness or deep breathing, or if I do want to go out and not drink, maybe I could just try it for an hour and ask a family member, you know, will you be around that if it does get too difficult and I do feel the urge to drink or to take something, that I can just leave, like, I kind of have an escape route. And change is possible. Recovery is absolutely possible. So we ended this session, as always, with supports for family members and for people using substances. So this is not an exclusive list. There are lots of other supports, but these are just some of the ones that might be helpful within our area. If you have any questions or if you want me to clarify anything, please feel free to get in contact. You have my number, 087 6955 557, and you have my email address. So my internet and both my phone coverage is intermittent at the minute, but I will, if you leave a message or send me an email, I will respond to it when I can. So I hope you're all doing okay, and that normal life as we know it will be restored very soon, and everyone will be back to having power and having internet connection and having phone reception and water and all these things that we take for granted on a daily basis. And I hope to see you all next Tuesday for the third session, which is Family Dynamics. Thank you and take care.